Contraception refers to the various methods used to reduce the chance of pregnancy. Understanding how these methods work, whether by preventing fertilization or implantation, is essential for your GCSE Biology exam. In this video, we will explore the major types of contraception and the key facts you need to know. At its core, contraception is any method that reduces the likelihood of pregnancy. It functions through two primary mechanisms: preventing fertilization, which stops sperm from meeting the egg, or preventing implantation, which stops a fertilized egg from attaching to the uterus wall. Different methods may use one or both of these mechanisms. Contraceptive methods are grouped into several broad categories, including barrier, hormonal, intrauterine devices, natural, and permanent methods. Each category has its own distinct way of functioning and varying levels of effectiveness. Barrier methods, such as condoms, are a well-known form of contraception. They function by creating a physical barrier that prevents sperm from traveling through the vagina and reaching the egg, thereby successfully preventing fertilization. Condoms work in three main ways: as a physical barrier to trap sperm, as a block to prevent fertilization, and, uniquely, as a method to reduce the transmission of sexually transmitted infections by preventing direct contact between bodily fluids. Here is a key exam tip. Condoms are the only contraceptive method that also protects against STIs. Be prepared to state this clearly, as no other method, including the pill or implants, offers this dual benefit. The contraceptive pill is one of the most common hormonal methods. It uses synthetic hormones, typically estrogen and progesterone, to interfere with the body's natural reproductive cycle and prevent pregnancy. The pill is highly effective when taken consistently. It works primarily by preventing ovulation, while also thickening cervical mucus to block sperm and thinning the uterine lining to reduce the chance of implantation. In a normal menstrual cycle, a surge in luteinizing hormone triggers ovulation. The hormones in the pill suppress this LH release, meaning no egg is released, making fertilization impossible. Certain hormonal contraceptives also cause the cervical mucus to thicken. This creates a physical barrier that makes it extremely difficult for sperm to travel through the cervix and into the uterus, adding an extra layer of protection. Intrauterine devices, or IUDs, are small, T-shaped devices inserted into the uterus. Copper IUDs release ions that are toxic to sperm, while hormonal IUDs release progesterone to thicken mucus and thin the uterine lining. Both types prevent implantation. For your exams, remember that IUDs work primarily by preventing the implantation of an embryo in the uterus wall. This is a crucial distinction compared to other methods that focus purely on preventing fertilization. Contraceptive implants are small, flexible rods inserted under the skin of the upper arm. They slowly release progesterone into the bloodstream over a period of up to 3 years. The implant works by providing a continuous, low dose of progesterone. This suppresses ovulation each month and thickens the cervical mucus, reducing the chance that sperm could reach any egg. Finally, contraceptive injections deliver a dose of progesterone directly into the body. Depending on the type used, each injection provides protection for approximately 8 to 13 weeks. Let's look at the contraceptive injection. Like the pill and implant, it releases progesterone to prevent ovulation and thicken cervical mucus. While highly effective, remember that it must be repeated every few months to remain active. This summary table compares the three main hormonal methods. While the pill is a daily tablet, the implant lasts for 3 years, and the injection requires follow-up doses every few months. All effectively release hormones to prevent ovulation. Natural family planning involves tracking a woman's menstrual cycle to identify fertile and non-fertile days. By avoiding unprotected sex during the fertile window, couples can reduce the risk of pregnancy without the use of devices or hormone. To practice natural family planning, one must track cycle length, monitor basal body temperature, and check for changes in cervical mucus. Note that this method is less reliable, especially with irregular cycles, and provides no STI protection. Sterilization is a permanent surgical procedure designed for those who are certain they do not wish to have children in the future. It is considered irreversible and is available for both men and women. A vasectomy for males involves cutting or sealing the vas deferens, which are the tubes that carry sperm from the testes. This prevents sperm from being released during ejaculation. It is a quick, highly effective procedure. Female sterilization, or tubal ligation, involves blocking or cutting the oviducts, also known as the fallopian tubes. This prevents the egg from traveling to the uterus and consequently prevents fertilization. Whether it's a vasectomy or tubal ligation, these are highly effective, permanent methods. It is important to remember that neither of these surgical procedures provides any protection against sexually transmitted infections. When comparing effectiveness, remember that different methods vary. In your exams, focus on which methods are the most reliable. The implant, IUDs, and sterilization typically show the highest rates of success. Effectiveness often depends on perfect versus typical use. For instance, the pill is highly effective when taken perfectly every day, but effectiveness decreases with typical use. Factors like missed doses or incorrect usage impact these rates. This diagram illustrates how various methods physically or hormonally prevent pregnancy. Visualizing these mechanisms helps clarify why some methods are more effective or suited for different circumstances. It is useful to distinguish between preventing fertilization and preventing implantation. Methods like condoms or the pill prevent the sperm and egg from meeting, while others, like the IUD, act after fertilization to stop the embryo from implanting. Hormones are essential to many contraceptive methods. By mimicking the body's natural hormones, they trick the system into behaving as if it is already pregnant, which prevents the release of an egg. Contraceptives often use progesterone, either alone or combined with estrogen. Progesterone alone is found in the mini pill and implants, while the combined pill uses both to provide stronger cycle regulation. To conclude, remember the vital distinction regarding STI protection. Only barrier methods, such as condoms, offer protection against STIs. This is a common and important point that appears in GCSE Biology exams. When choosing a method, consider the duration of effectiveness, ranging from short-term options like the pill to long-term implants or permanent sterilization. Remember that only condoms provide dual protection against both pregnancy and STIs, and some people may prefer non-hormonal options. To understand how hormonal contraception works, it helps to know the menstrual cycle. Ovulation usually occurs in the middle of a 28-day cycle. Hormonal methods disrupt the signals that trigger this release, while barrier methods work during intercourse regardless of your cycle stage. Each contraceptive method targets a specific stage of the reproductive process. Some methods prevent ovulation, others block sperm transport or fertilization, and some, like the IUD, act to prevent the implantation of an embryo. Here is a quick summary. Barrier methods like condoms block sperm and protect against STIs. Hormonal methods like the pill and implants prevent ovulation. Intrauterine devices prevent implantation. Natural methods involve fertility tracking, while permanent options like vasectomy and tubal ligation are surgical. Avoid common exam mistakes. Be precise. IUDs primarily prevent implantation, while pills and condoms prevent fertilization. Remember, the pill does not kill sperm. It prevents ovulation and thickens mucus. And always remember, only condoms protect against STIs. More things to keep straight. A vasectomy is male sterilization affecting the vas deferens, while tubal ligation is female sterilization affecting the oviducts. Always describe sterilization as permanent, and be specific about the hormones. Most hormonal methods use progesterone. Let's look at a practice question. If a student claims the pill is best because it protects against pregnancy and STIs, they are incorrect. While it prevents pregnancy by stopping ovulation, it does not provide STI protection. Only condoms do that. Next question. How does a vasectomy prevent pregnancy? It involves scudding or sealing the vas deferens. This prevents sperm from being released during ejaculation, meaning it cannot reach or fertilize an egg. Remember, sperm production still continues in the testes. Finally, how does the pill work? It prevents ovulation by suppressing the hormones that trigger egg release, and it causes cervical mucus to thicken, which makes it harder for sperm to travel. Some also thin the uterus lining to prevent implantation. To summarize your exam preparation, remember the key categories: barrier, hormonal, IUD, and permanent. And above all, never forget that condoms are the only method that offers protection against STIs. Good luck with your studies.